Hi, I'm Dr. Jason Terk. I'm a pediatrician practicing in the Fort Worth, Texas area, and I'm the current chair of the Texas Public Health Coalition. I'm very glad to be with you today.
Yes, thank you, Dr. Terk. So there's been a recent concern in the United States due to the reemergence of vaccine-preventable diseases as a whole. And despite the benefits of immunizations, factors that may impact immunization rates in Texas are access to health care, children not receiving their vaccinations on time, policy and legislation, of course, which are lenient towards exemptions, and societal attitudes and beliefs regarding vaccinations and a growing anti-vaccination movement. And decreases in the rates of childhood vaccinations leave the population vulnerable to the risk of being exposed and contracting an infectious disease in the event of an outbreak, as we've seen in the past of vaccine preventable diseases in the population. So I know that there's been a lot of progress when it comes to COVID-19 vaccines, but could you speak a little bit as to how the Fort Worth community is doing in regard to vaccinations?
I think overall, Fort Worth area and Tarrant County area has done a pretty good job. We have obviously different segments of the population. We have early adopters and enthusiastic people. People in healthcare generally have been very happy to get vaccinated. And many people in the community also have been excited to get vaccinated. I think we've had a lot of progress made in the most vulnerable parts of our population, which of course are the elderly and the people who have serious underlying health conditions. As the authorization for COVID-19 vaccination has dropped in age and scale, we've moved to a part of our pandemic where we have a lot more supply than demand. And I think we're now at a part of our journey with vaccinations in Tarrant County and Fort Worth area, as well as across the state of Texas and the United States, where we're going to need to redouble our efforts to appeal to people to get vaccinated. As long as we have a significant segment of the population that remains unvaccinated, it basically is fertile ground for the virus to replicate and ultimately potentially create more variants, which may render our vaccines less effective. And so we need to continue to work hard at this.
Yeah, definitely. And so this population of Texans who are hesitant to receive the vaccine and the COVID-19 vaccine, just in general, could you tell us a little bit more about what is creating so much hesitancy among these populations or these specific communities?
Well, I think that it's challenging for some folks to process what is a dynamic environment and dynamic information that comes out from authoritative bodies like the CDC. People like to have things that are relatively concrete, and when you have a dynamic situation that's rapidly changing, it requires adjustment. It doesn't necessarily inspire confidence that any one thing that is said is going to be concrete enough to stake your decision upon. And so we need to continue to explain why recommendations change and why it's important to follow the recommendations as they come out and what they're based upon. There's also sometimes an issue of groups which are actively seeking to undermine confidence. And I think we're all pretty understanding of that. And Texas is definitely a hotbed of the anti-vaccine movement. And even in my community, they're very, very active. And so it really is unfortunate. And even people who are trying to make informed decisions may have real challenges because it's difficult for them to discern what is misinformation, what is deliberate misinformation that is intended to divert them from what is the right thing to do for their own health and for the health of themselves and the community.
Absolutely. And just, a little bit more about hesitancy and as far as what you've seen in your community, have you seen inequities or disparities play a significant role in this kind of culminating into a vaccine hesitancy?
Well, part of the issue isn't just a matter of hesitancy. So, we have communities which have historically had challenges to accessing care. And so that same challenge with access to care impacts upon their ability to access not just COVID-19 vaccination, but any recommended vaccination. And so we need to continue to work hard to eliminate the disparities in access to care. We also need to make sure that we are appealing to people who make decisions about where vaccines are available so that those communities that have difficult time getting access can have better access to them. I think that there's a tendency to erroneously assume that people who have been historically victims of disparities and inequities are going to be naturally hesitant to vaccines. I think that's a little bit of a myth, especially when you look at the evidence, which is a historically disadvantaged population along the border, which was disproportionately affected by COVID-19 disease, is one of the highest uptakes of COVID-19 vaccination. So you have a historically marginalized community that really is leading the state in ability to get vaccinated. So I think it's a complex issue. We certainly need to have the right message. We certainly need to have the right messengers, but inequities and disparities don't necessarily lead to vaccine hesitancy in and of themselves.
Absolutely. I think it's really interesting that you pointed that out, and you really just brought me to my next question. So as a local pediatrician, what messages do you think your community needs to hear to kind of be able to overcome this vaccine hesitancy and kind of really take that move towards getting their families, their children, and their loved ones vaccinated?
Well, I think that people that have the relationship with families need to feel comfortable using that relationship to counter misinformation and myths. Take the time to ask questions. Have you gotten your COVID-19 vaccination? Well, yes, that's great. So I'm really glad you've done that. Or no. And well, do you have any concerns about that? Or what questions do you have? Or why have you had a hard time accessing? Just being willing to take the second or third step to delve into that so that you can engage them on what might be erroneous information that they've been given or misinformation that they have been led to believe. And so the message that needs to be transmitted is that while this was an expeditious process in getting the vaccination to us, it was not one in which any corners were cut. And there are a number of specific reasons why we were able to get vaccinations out very quickly, including the fact that we were working on COVID vaccinations, I should say, from the start of the first coronavirus outbreak at the beginning of this century. They were working on coronavirus vaccinations, and so they had something on the shelf ready to go. And then the second reason was because the government was able to indemnify vaccine manufacturers so they weren't taking any financial risk, and so they could go very quickly to large-scale studies that proved out not only how safe they were, but how effective they are. And our experience with the vaccinations since they've come out has reinforced the information that we got from those studies. So the data are clear, the vaccines are extremely effective, and they are safe. And if there is a question that is raised about a particular safety signal, then we answer those questions to make sure that it's not something that's being caused by the vaccination, or if there is an issue, that we respond to it.
Definitely. And I feel like the videos that Cook Children's has come out with, the series of videos, kind of everything you need to know about vaccines for children and families, is really, helpful in kind of getting those messages across. And the work that Children at Risk is doing with our Vaccine Information Project is kind of geared towards the same idea as reaching out to community leaders and people that have trusted relationships with these members that are a bit more hesitant, and kind of giving them the messages and the toolkits to kind of get through to them themselves.
Absolutely. But nothing replaces the actual in-person interaction and talking to someone about it.
Absolutely. Absolutely. And that's something that we've seen kind of in our discussions with physicians across Texas and just community members, is that interpersonal relationship is key.
Right.
Yeah. And so on a more general note, I guess, as far as vaccinations go as a whole in Texas, and seeing how over the decade the rates have fallen so drastically, really, why would you say it is important to ensure children receive all of their recommended childhood vaccines? And particularly during the pandemic, when not only are children falling behind on getting the COVID-19 vaccine, but also their regularly scheduled vaccines?
Well, we unfortunately, like everybody else, had to shut down at the very beginning of the pandemic, and no one was really coming to the doctor for preventive care visits, except for the very young babies who absolutely needed to get their initial vaccinations. And some of them we had to convince to come to see us. we've been playing catch up ever since then about getting kids back in to get caught up in vaccinations. And as long as we have lower rates of vaccinations in certain populations, we are at risk for outbreaks of diseases that are not COVID-19, like measles. And so it's extremely important that parents get their kids back to us to get their preventive care services done, which are not just vaccinations, but all the other things we do to keep them well and safe. But specifically on vaccinations, we do continue to have opportunities for improving our vaccination rates and recovering them to where they were pre-pandemic. And even pre-pandemic, we still had some work to do in some areas. And so we're continuing to work at it. We have plenty of capacity here in the doctor's offices. So parents just need to give us a call and get in for their checkups, and we'll get everybody caught up. And hopefully we can get through this without having an unfortunate additional outbreak.
Yes, definitely. I think that's really important to kind of not forget about all these other vaccine preventable diseases that are, really on the horizon just because we're in the middle of a pandemic. And the focus has been for the past, over a year, COVID-19, but there's other vaccine preventable diseases that we really need to be thinking about as well.
Right.
And so what would you say to families that are preparing to or not to vaccinate their children?
Well, I think it's really important to kind of bring people up to date about where we are with the authorization of vaccinations. And right now we have the Pfizer-BioNTech vaccine that is authorized for kids down to 12 years of age. And the data on that authorization is really, really solid. I mean, it's basically 100% effective at preventing COVID-19 in that population. And so it's an absolute dream come true when it comes to the protection you're going to get. Parents may have the assumption that their kids are not necessarily at risk for getting something serious arising from COVID-19, but we have seen some serious outcomes in teenagers and teenagers. And we don't know ultimately how things are going to evolve. We have this variant in India right now, which is affecting younger populations, and it's much more easily transmitted. And I think we have to assume that it's not if, but when that variant ultimately becomes a predominant strain here. And as long as we have a population of people that is unvaccinated, and that includes the adults who have chosen not to get vaccinated, as well as teenagers and teenagers who have not gotten vaccinated, we are at risk for having things blow back up again in ways that we haven't seen so far. So I think it's the right thing to do. We have the opportunity to get it done over the summer. There are plenty of outlets to get your kids vaccinated, including your doctor's offices. The storage requirements and transport requirements have been relaxed for the Pfizer vaccination, which makes it much more practicable for us to be able to do it in the office. So definitely get it done, 100%. My kids have been vaccinated, and I encourage all my patients to do so as well.
Absolutely. Thank you so much for your time, Dr. Terk. It's really wonderful to kind of hear whatever, we talked about today, and how there is hope, and as long as families, continue to be educated and remain vigilant, that we can really get the majority of our population vaccinated, and hopefully in a number that's headed towards herd immunity to kind of mitigate all of these risks that are associated with it. Yeah. So that's awesome. Thank you so much for your time. I will just go ahead and share a slide for just, more information if anyone wants to kind of get involved or is curious about what they can do to kind of help with the impact that, physicians like Dr. Terk are trying to have on their communities. And so if you'll just give me 1 second. Yes, so for more information, please check out Cook Children's Hospital. They have a series of videos, like I was talking about, kind of discussing the different aspects of COVID-19 vaccines in the Fort Worth community, kind of giving you a how-to as far as, basic information around vaccines, how they work, and all that kind of thing goes. And children at risk, yes, please, feel free to check out our website, Work as a Champion for Children, and stay involved in all of our health policy advocacy alerts.